A very good morning to you. It's good to see you on this 25th day of April, actually the last Tuesday of the month of April. So I hope that you've made better use of the month. Welcome to the show. This is Your World, and my name is Winnie Lubembe. And of course, today being the 25th day of April, of course, the day is very special because it is World Malaria Day. And of course, every year, the world marks Malaria Day on 25th April. So this year, the day will be marked under the theme, Time to Deliver Zero Malaria. And of course, 3 key I's, all right? One is to invest, innovate, and to implement. And of course, with a very special focus on the third I, and that is implement. So for a while now, we all know that malaria interventions in the country have included distribution of mosquito nets, spraying, and minimizing potential breeding grounds. But is this enough? That is the question. And at the same time, nearly 4 years after the introduction of the RTSS malaria vaccine in parts of the country, how has the 4-dose vaccine being integrated into the national immunization program? So that is what we'll be focusing as well on the conversation. And of course, this year, the day will be marked under the theme, like we said, to deliver zero malaria, invest, innovate, and implement. 3 important I's that we'll be looking at. But before we get into the conversation, let's take a look at some of the numbers. And again, we begin on a global scale, where according to the latest World Malaria Report, this was published in December 2022, it shows that 247 million new cases of malaria were reported in 2021. And this is compared to 245 million in 2020. So, of course, we can see a slight increase over there. And then 619,000 people died in 2021 compared to 625,000 in 2020. A bit of a decrease as well on the same. But at the same time, 95% of all malaria cases are in World Health Organization, African region. All right, we'll be looking at why that is the case. 95%, that's a huge number. But at the same time, let's bring it back to the country, where in the country, and this is according to the CDC, that is the Centers for Disease Control, so there are an estimated 3.5 million new clinical cases and 10,700 deaths every year. But again, different statistics show that, again, we have like 12,000 deaths every year, and this is from malaria. So I think we'll get, you know, a better understanding of the same from the representative that is from the Ministry of Health, and that is on the malaria control program. But at the same time, those who are living in Western Kenya have an especially high risk of malaria, and I'm pretty sure this is not new to, you know, all of us. We know why, but of course, again, we'll be focusing on these regions in just a moment, given that, again, this year's you know, World Malaria Day will actually be marked in Nyamira, and one of my guests will actually be joining us from there. But there's a bit of a concern, and this is from the World Health Organization, where the concern is that the world is not on track, and this is to reach 2 critical targets of the Global Technical Strategy for Malaria, and this is from 2016 to 2030. So one of them is to reduce global malaria case incidence by 90% or more by 2030, and at the same time to also reduce the global malaria mortality rate by 90% or more, and this comes at 2030. All right, so of course we'll want to say or take a look at how exactly we're doing as a country as far as these 2 very important targets, and that is set aside by the Ministry of Health. So again, you want to stick around until the end of the show to really, really understand, first of all, where are we as a country? How are we doing? What are some of the tools, you know, that's actually being used by, you know, the health ministry, just to make sure that, again, we achieve this. And of course, we get back on track, because again, if you remember very well, in 2019, 2020, of course, with COVID-19 created a lot of disruptions And of course, so many services were impacted, including, malaria response as well. So how are we doing as a country, even as we track, the new infections and the deaths as well, and what are, again, some of the tools that are being used by the Ministry of Health? Again, let's focus on that conversation. And of course, joining us in studio, we have Dr. Chris Baraza, who's the Chief of Party, AMREF Health Africa, Kenya. Thank you so much for joining us this morning.
Thank you so much.
This is a very special, important, I would say, area for you, because you had an incident, right, as far as malaria is concerned, but at the same time, you also deal with a lot of cases as far as women and children are concerned when we talk about malaria. So the perfect person to have this conversation. Thank you for sparing your time, excuse me, this morning. And also joining us via Zoom, we also have Lanson Karuki, who's the Principal Medical Entomologist from the National Malaria Control Program, joining us all the way from Nyamira, I believe. Lanson, it's so good to see you. I don't know if you can see me. How are you doing this morning?
Thank you.
Okay, perfect. All right. And of course, you're joining us from Nyamira, right? Where the day will be marked. Lanson, are you?
Yes, I'm in the office. I'm in Nairobi.
Are you in Nairobi?
We have a team already in Nyamira doing this.
Okay. All right. I see that. Okay. And then, of course, we also have Caroline Ondoro, who is, here to share her experience as far as malaria is concerned. So, Caroline, I don't know if you can hear me. I can see you. Good morning. Thank you so much for sparing your time. How are you doing?
I'm doing fine.
All right, and thank you so much for agreeing to speak with us, as far as malaria is concerned. So before I speak to you, Caroline, let me begin with Lanson very quickly. Based on the numbers, so the numbers that we got are from the CDC, and this is 3.5 million new clinical cases of malaria are reported every year, and then 10,000, slightly over 10,000 cases of people dying each year from malaria, but then other, sources would say 12,000. So how are we doing exactly as far as malaria is concerned in the country?
Yeah, thank you so much. I think we are not doing very bad. We are fairly doing well. If we look at the prevalence of malaria from the last 5 years, in 2015, you were speaking about 8% of malaria prevalence in the country, but now we are talking about 6% in terms of malaria prevalence in the country. This clearly shows that there has been a reduction of about 2%.
Yeah.
For the last like 1 decade, we could speak of maybe in 2015 about 122 cases per 1,000 population in the country in terms of malaria incidence. But now we are talking of about 90 cases per 1,000 in 2022. So we are fairly doing well in terms of malaria reduction.
Okay, all right. But I mean, despite the fact that malaria is preventable and treatable, again, we're still seeing a lot of people who are dying from the same. And of course, the biggest question will be, number one, why? I know there's so many interventions that have been put aside by, the Health Ministry together with the Malaria Control Program, just to make sure that, again, we minimize the number of people who die from the same. But at the same time, we're still witnessing deaths. So I'll come back to you to really understand why is this the case. But also, there's a new invasive species of mosquito, that has been found in the country that, again, scientists fear that this could reverse the gains that have been made. And this is as far as, malaria is concerned. So we'll come back to you to really understand what exactly is this species and how bad can it get. But let me speak to Dr. Chris. Again, Dr. Chris, like we said, this is a very, this is like your area of focus really, as far as malaria, and especially among women and children, right? So can we really understand why there's two groups of people?
Thanks so much. First and foremost, yes, I'm a gynecologist, so I'm able to handle a lot of pregnant women. So those two are very special cases. That's children and women. Among children, I would say that I'm a malaria survivor myself.
Okay, all right.
I think when I was about 11 years, I had a nasty experience because I come from Western Kenya, where malaria is very endemic.
Yeah.
Yeah, so I got a bout of malaria that complicated, and then when I was treated, I think there was a medication error, something I came to learn much later when I came to medical school. But what I know is I passed out after I got some injection at some point. So I think more or less that informed my decision to do medicine and become a doctor, because I thought maybe I should focus on treating children at that point in time. But as time went by, I focus now on women. Children are more vulnerable because of their low immune system, and especially in the endemic areas. They are also, their body is not fully matured to handle most of the infections that happen at that age. And then the issues to do with also malnutrition come in. The more malnourished the child is, the more immune suppressed they are. Women actually also are more vulnerable. So we call those two populations special populations in as far as malaria is concerned. Because once a woman gets pregnant, the hormonal changes that happen makes their body more vulnerable to infections of all kinds, not necessarily malaria. The second thing among women who are pregnant, especially, is that malaria, especially the type called P. falciparum, has a way of hiding, quote by quote, we call it hiding in the placenta, so that the immune response that's usually mounted by the body is not effective. So we take cognizant of that and are very, very keen and very careful when handling women, especially in malaria endemic areas.
Absolutely. And I know that there are several campaigns, and we see this on television, in radio, on social media, as far as make sure you sleep under, a treated mosquito net, make sure that, you take all the necessary, precautionary measures. But at the same time, we still have, people who are still diagnosed with malaria, and others in really, really severe cases of the same. So the big question is then, is it time we change tact in terms of, how we approach this? So that we see a more effective and robust, tools that are set aside just to make sure that we fight this, because there's a goal that is by 2030 in terms of reduction of the incidence and mortality rate. And you also talked about being a survivor, and I know majority of the times when we think about a survivor, it's like on a more severe near-death experiences, usually, towards like the darker side. So I'll come back to you to really understand how bad can it get. And especially if timely intervention is not put in place, early treatment and all those things. And even for your experience, how bad did it get? Because like I said, you passed out at some point. But let's speak to Caroline, and then we'll come back to you, Dr. Chris. So Caroline, when were you diagnosed with malaria, and how was it? Take us back.
I do remember it was in 2013 when I was pregnant. That was my third born, and I didn't know that I had malaria. When I went to the hospital is when they diagnosed me with malaria, and unfortunately I lost the baby, the twins.
I'm sorry.
And I was treated for that malaria. And that's why I joined the work of the CHB, to at least champion the work that the CHBs do. And even in the hospital, how they assist the mothers on how to prevent malaria. Unfortunately, I realized that I wasn't sleeping in the net because of some reasons which could be prevented. Because I was reacting to the medicine which was in the net? Yes. But I didn't know that at first I had to I was to wash the net, or I was to expose the net before tying it. Yes.
Okay.
But it's something which could be prevented.
Absolutely.
Yes.
And I'm really, really sorry for the loss of your twins. And really thank you for just, speaking to us and helping, to educate as many people out there, and particularly women. And let's speak to you now in terms of the different approaches, and just listening to what Caroline has mentioned. Number one, that the fact that she did not know that she has malaria. And this is interesting to hear, because majority of the times we self-diagnose, if I can say that, because, you have some slight fever, and pain in your joints here and there, and of course and headache, and the first thing that people would say is, we're on malaria, right? So are there some of these other symptoms that maybe people do not know about, that we should know about?
Sure. Thank you so much, and sorry, Caroline. I think in terms of malaria, it's very important we monitor the symptoms. There are things that we may feel ourselves, especially fever and chills. At times, you may experience weaknesses, especially in your body. And at times, it may present itself in flu-like symptoms. So once you feel that you have these symptoms, it's very, very important. Additionally, I think, as Caroline has said, it's very important, especially for pregnant women, and one of the colleagues that we have in studio has mentioned about why pregnant women are most affected. One of the measures, or some of the measures that we put in place to ensure that we protect this vulnerable population is ensuring that we provide them with nets whenever they visit clinics during their antenatal care visits, and also we provide them with necessary preventive medicine that we call SP, so that they can be protected from malaria. Thank you, and over to you.
All right. Dr., do you want to contribute to, and especially to what Caroline, said? Because pregnancy, it can be very complicated, because majority of the times you're told you cannot take this drug, you cannot just take any drug, during pregnancy. And now comes malaria, right? And of course, you have to go through treatment. Can we just address this period that can be a little bit complicated to many people?
Yeah. Okay. Thanks so much for that, and sorry about that, Caroline, for that unfortunate incident. But Caroline just represents very many women, some of whom actually go through this and they don't even know. In my very formative years as a doctor, actually, there's a lady who came to me. She was just newly married, and she had malaria. That was in Kisumu, but she didn't know she had malaria. So she just had fever. Went to hospital, was given medications, and she had a miscarriage. So we usually look at what could be the causes of miscarriage, because in a woman pregnant but could be having malaria. So fever is one of the things. Very high temperatures in the body could actually lead to a miscarriage, for that matter. When you have malaria, again, there's likely that there are other infections. Urinary tract infections could actually also be associated around the same time, because of the low immunity that the woman may be having. So again, that may actually predispose to that. But again, at the same time, there are some medications that we don't prescribe in early pregnancy. So if a woman goes to hospital and they don't know they're pregnant, and then we start treating them with antimalarials, some of them can actually lead to predispose to what we call low uterine contractions, and it may actually predispose to a miscarriage, for that matter. So miscarriages are likely to happen in such cases. But as the pregnancy progresses, then you find that other complications of malaria come in with anemia. Severe anemia is a very likely cause of actually, again, miscarriage, for that matter. So women will come with severe anemia. Sometimes, depending again on the complications, they may have other organ failure. So the kidneys may start actually failing because of severe malaria. They may have the liver having issues because of severe malaria. And all these issues may actually affect the pregnancy. It's not just affecting the mother alone, but also to the baby, the unborn child. Because with anemia, there's poor circulation of blood to the placenta. So that actually leads to what we call a low birth weight baby. So the baby will be having lower weight compared to the normal population. At the same time, because of what I mentioned earlier, that some of the malaria parasites get into the placenta, and it therefore affects the blood flow to the baby. So this affects the nutrition and the growth of the baby. So a baby will definitely be smaller for size at that particular point in time. So it has very adverse complications, in addition to others that may include cerebral malaria. Can actually lead to issues to do with some women may come, or some patients may come, and they say they have psychotic presentations because of cerebral malaria, for that matter. Some of them even have shock. Shock may happen in some of these because of the severe anemia resulting from severe malaria for that matter. Yeah.
All right. So I think the biggest question that I think Letson might answer is, do we have like an incubation period where upon, so like being infected with malaria up until one gets, to a severe case? Is there like an incubation period or not? And why is it that there are some people who will be infected, get treated, and that's it? And there's some who will get the severe, form of malaria. Very quickly, before we go on the break, before I forget this, Caroline also mentioned that she was not able to sleep under treated mosquito net because, again, she reacted to, whatever product that is used to treat the mosquito nets. Is this what you see majority of the times?
It can happen.
Yeah.
And let me just talk to that, because there are very many partners, including AMREF, where I work, that are actually supporting the interventions, including supply and distribution of mosquito nets, and other interventions that include actually just advocacy. But surprisingly, the Kenya Malaria Indicator Survey that was done just about 2 or 3 years ago, unfortunately indicated a relatively low, information. There's a bit of a gap. Just about a third of the population who are aware about the need for them, or rather were having the mosquito nets, for instance. This was affected majorly by, again, COVID-19. It really affected a lot. The endemic regions, there's a better uptake up to around, Lenson may maybe talk to this, but they have a better uptake of this, more than 80% of the population. But generally across the country, you find that just about a third of the population. And the households actually have mosquito nets. When it comes to knowledge, because there's one thing in terms of having knowledge, having the mosquito net, and utilizing the right way. For instance, Caroline now, when you do a survey, you'll say that she has a mosquito net, but she wasn't using it for reasons. So that's just one of the reasons. And she knows
it's important.
And she knows it's important, but she's not using it. For her, it was unfortunate because it was a factor beyond her control that she reacted to it. But the knowledge she didn't have was that you needed to wash this mosquito net before you use it, so that you can dilute the effect of the insecticides that they actually apply on those mosquito nets. So there are those other factors. There are studies that have actually demonstrated that sometimes you give mosquito nets to households, and they use them actually to protect their kitchen gardens.
That's true.
So you say that you have a mosquito net, yes, but it's being used to protect a kitchen garden. So then you ask yourself, why is it that the malaria problem is not going down? Because of utilization. So there's what we call knowledge, attitude, and then practice. What's the practice in as far as the use of mosquito nets are concerned? So there's a lot that need to do in terms of actually not just providing the mosquito nets, but going beyond that and properly informing the population on how they are supposed to use them and what are the benefits of using these mosquito nets at that point in time.
Okay, all right, so let's take a break, but of course when we come back we'll hear more from Lenson and Caroline as well, as far as malaria is concerned, and the efforts that are being put in place, and of course for Caroline especially now that she has joined the program just to make sure that to empower and educate as many people out there as far as malaria is concerned. We'd also want to hear from her more. But again, if you have a question as far as malaria is concerned, at NTV Kenya, both on Facebook and on Twitter is how you can reach us. But better yet, give us a call. The numbers will be down on your screen. So there's so much to come. I can see your time is far much spent, but still we have so much to cover as far as malaria is concerned. So stay with us. We're coming back very shortly after this break.
All transactions with DTB are secure. Achieving more for you is the least we can do. Because at Diamond Trust Bank, you don't just bank with us, you bank on us.
Santon, a fun new world of flavor, fruity freshness in every sip.
Daring Abroad makes me dare.
It's the only show of its kind in the world. And now, it's bigger.
And even more entertaining and informative than before.
Hapa kunaitwa Kakoe na inatubamba sana.
From London to Jersey Island.
Goma in the Democratic Republic of Congo to the scenic features of Uganda, the Pearl of Africa.
And many more places abroad and at home.
I watch Daring Abroad. I like the stories which people bring.
Daring Abroad every Saturday at 7:30 p.m. with repeats every Sunday at 1:30 p.m. on NTV.
Own your dream home for as low as 1.98 million Kenya shillings in Vipingo Kilifi. SMS Vipingo to 22365 or call us today on 0740 400 215. Terms and conditions apply.
Right, welcome back. Malaria, this is World Malaria Day, right? I was about to say Malaria Day. World Malaria Day marked every 25th day of April. And of course, the theme for this year is time to deliver zero malaria. And of course, 3 important I's, that is the focus, and that is invest, innovate, and implement. So how are we doing as a country as far as these 3 I's are concerned? And of course, given the 2030 goal, and that is the global goal rather, that is to reduce global malaria cases incidence by 90% or more, and the second one is to reduce the global malaria mortality rate by 90% or more by 2030. So again, what are some of the efforts that have been made in the country just to make sure that again we achieve this goal, but also we go back on track? And this is as far as the fight against malaria is concerned. Dr. Chris Barasa, Chief of Party, Amref Health Africa, Kenya, is here to help us with that conversation, as well as Lenson Karuki, Principal Medical Entomologist from the National Malaria Control Program, as well as Caroline Ondoro, who is here to share again her experience as far as malaria is concerned. And like I said, if you have any question as far as either the vaccine or treatment, or again the interventions that have been set aside just to make sure that we fight malaria, again, engage with us at NTV Kenya, both on Facebook and on Twitter. What are you doing as an individual to also contribute towards this fight? Because like we said, it's one thing to say the government should, but it's another thing to also take part in the same. So what exactly are you doing to make sure that we fight and end malaria by 2030? Also let us know at NTV Kenya, both on Facebook and on Twitter, and also give us a call if you want to speak to us directly. Our lines are open. So Lenson, there's a lot that was mentioned by Caroline, and of course with also Dr. Chris, as far as number one, it's one thing to have, the mosquito nets distributed, because I know the Health Ministry, together with the Malaria Control Program, you have a target, and this is to distribute millions and millions of mosquito nets again to the people, especially in the endemic areas. But there's also the vaccine aspect of the same, which the Health Ministry said, again, we're increasing the rollout of the same. I know with the pilot, concentrated on specific parts of the country, but again, there's also the goal towards that. But the other thing is the level of awareness of people as far as using this mosquito nets. Caroline mentioned a number of things. Number one was, the she reacted to the insecticide that was used. And of course, Dr. Chris also mentioned something, which is it's one thing to have the mosquito net and to distribute, but also it's another thing to make sure that people are using. So in terms of tracking and making sure that people are using this mosquito nets, what has been one of the biggest challenge in making sure that people use it, so that you don't just collect data and say millions of people have mosquito nets, but they're also using them? Lenson, I don't know if you can hear me.
Yes, thank you so much. Thank you so much for highlighting those issues. Indeed, as Dr. Chris has mentioned, it's one thing to have a net, and it's another thing to utilize that net. We've seen that we have achieved high coverages in terms of distributing nets and access, but when it comes to utilization, we are having a challenge. One of the things that we've been doing as a ministry is to ensure that we have a very strong socio-behavioral change strategy and toolkit that we've been using, one, to inform the public, all the population, on how to use these nets. As Caroline has mentioned, for example, wherever you open a net from a package, one of the things you are supposed to do is to ensure that you put that net outside, so that at least the concentration of the chemical can come down, and that way you will not react to the insecticide that is in the net. So we have been using media to ensure that we get this information to the public, and also we are leveraging on the existing health system, especially the community health strategy, whereby we use the community health workers to distribute these nets to the last person in the community where we target the distribution, and they also communicate this to the public. How are you supposed to use these nets? Again, we have been using the social media to ensure that we achieve this. But once in a while, we usually track this through some surveys. We conduct social behavioral surveys to monitor whether people are using these nets or not. And if they are not using the nets, we try to find out why are they not using the nets, and we usually come up with some mitigation measures to ensure that the communities are using these nets. Over to you.
All right. And there has been several concerns as far as the quality of, the nets that are being distributed. And I think if you've ever used it, I'm pretty sure you know how sometimes tough, the material can be, and also that whole aspect of, the insecticide that is being used, and people, again, not being aware that you're supposed to, again, like you said, air dry it, or at least wash it so that, again, you reduce that. So when it comes to then the quality, because the goal is to make sure that, this is one of the measures that have been put aside to make sure that we fight malaria. So if the quality is, a little bit compromised, don't you think this will still impair the fight? And this is as far as ending malaria. So I don't know what you have to say to that in terms of the quality of the nets that are being distributed.
Thank you so much for that question. I think in terms of quality, I can assure Kenyans that the nets that are distributed in the country have high quality standards, in the sense that these are nets that have been approved by World Health Organization, and these are nets that have been registered with the Pest Control Product Board. These are the two requirements that we must ensure before these nets are distributed to the public. Right. So in terms of quality, we've no doubt that the government gives the best nets in the country.
Okay. All right. Thanks for that. Caroline, let's speak to you. So first of all, how far along were you when you were pregnant, and when, of course, you started experiencing symptoms of malaria, and how long did it take, at least for you to get either to the hospital and get your diagnosis and also be treated for the same? Because again, sometimes the diagnosis might be missed, or sometimes people tend to self-diagnose before getting to a healthcare facility.
Okay, thank you for having me. When they found out that I was having malaria was when I was around 4 months pregnant.
Okay.
But I didn't know. I just came for a routine checkup, but I was feeling some symptoms. I had some chills. I had some joint pains. Then I also had some fever, though it was mild. After the complaints is when I was given a request to go and test in the lab, and they found that I had malaria plus.
Oh, okay.
I was admitted for 2 days. After the admission is when I lost the baby in the ward. Yeah, but it was around 4 months.
4 months in.
Yes.
All right. Do you try to, take like certain medication to at least help with the, with the fever and the chills and the joint pains and all those things? Did you try before you went to the hospital? Because you said you just went for like a routine checkup.
No, I didn't take any medication in the house because I didn't know what was ailing me, and I just came for my routine checkup. And after the complaints, then I was requested to go to the lab. From the lab is when they diagnosed me with malaria, and I was admitted.
I see that.
Yes.
I see that. And again, it's just unfortunate that you really, lost your babies to malaria. But again, so having joined this program, I mean, at that time, how much of information did you have as far as malaria is concerned? Because again, like I said, majority of us, we just know malaria is like headache, fever, joint pain here and there, it's malaria, but that's it, right? So how much of information about malaria and how bad it can get? Because again, like you said, you were diagnosed with malaria plus, right? So do you know what exactly that meant at that time? And even after just, recovery, did you have moments where you had to just, sit down and really, really read about and, gather information as far as malaria is concerned, and especially the malaria plus that you were diagnosed with?
Yes, I had a clinician who took me through and explained to me what the pluses meant. And then I was also counseled, but I didn't know that it could lead to me losing the babies. But at first, I never had any idea. I never had any idea, and I didn't get any information. But after losing the babies, when I had that passion of joining other women, now to also enter in the field of the health workers as a CHP, to also teach other mothers on the prevention measures which could be avoided in the community.
Okay. And having interacted with this, all right, go ahead.
I can say through losing the babies, it gave me passion to teach and also to encourage other mothers to use nets correctly.
Okay.
And also to take SPs. There's this medicine pregnant mothers are always given every month. I encourage mothers to take that medicine because it's the preventive measures to the women. I wish I knew by that time. I think I could have not lost the babies.
Okay.
But again, it gives me, what do I say? It gives me like courage to teach my colleagues and also to visit mothers in their households, to teach them how to tie the nets, to assist them on early NC visits. Immediately they find out that they are pregnant, they are supposed to come to the facility immediately, not wait until they are 6 months, because when they are 6 months, there's nothing we can correct at that moment.
Absolutely.
So I encourage our community to do what is right.
Absolutely.
Yes.
And it's really commendable, to see the kind of work that you are doing really to help as many women out there who might not have the same information, that you have now as far as malaria is concerned and how bad it can get, in terms of, severity. What is one of the biggest challenge that maybe, these women would tell you? And again, as far as malaria response is concerned, in the country, what is that, one of the biggest challenge that you feel we really need to do something about this?
It is the time factor. At times you tell a mother to go to the hospital and she tells you she will go. She still wants to care for other babies.
Okay.
Another thing is the economic constraints, yeah?
Sure.
That these mothers who are the breadwinners in their families. So when you give them the referrals to the facility, they tend to go to their workplace first, is when they look after their health. But through all that, we also give them health education. We just continue giving health education until they get some sense into them. Yes, because health is theirs, not ours. It is for everybody. In particular, because if we lose a mother in the community, it is a life that we have lost. And no mother should die of malaria because it is preventable and treatable.
I like that. I like that. No mother should die. And I mean, no one should really die from malaria. And of course, in this day and age where there's a lot of information and of course, various interventions, you know, that have been set aside to fight the same. And given that we have a goal to achieve, and this is by 2030. And Dr. Again, several things that Caroline has pointed, which is very, very important, you know, for all of us to really know. But back to that question that we asked earlier on, as far as the incubation, I don't know whether it was you or Lanson to answer that, but I think you can. You can answer that as far as the incubation period, and how is it that there's some people who would get malaria, get treated and be okay, and others would get like a severe form of malaria?
So thanks so much for that. And just like any other infection, they usually have what we call incubation period. That's the period between the time when you get a mosquito bite and the time when you start having symptoms. So usually within 2 weeks actually of being bitten by a mosquito, you'll be able to start having those symptoms of malaria. And the severity will depend on several factors. One of them is, have you been exposed to malaria before or the parasite before? So if you have been exposed in early childhood, then chances are that you have developed some immune system. So there are some antibodies that have developed in your body that can be able to manage that particular infection for that matter. And that's why you find that people who have not been in the malaria endemic areas, when they travel to these particular endemic areas, we usually want to give them a bit of preventative measures. So you tell them, can you take some medications at least 2 weeks before you get into a malaria endemic area?
Are they the anti-malarial?
Yes, prophylactic and malarials for that matter, so that you can be able to develop a bit of an immune system. If a child or a pregnant woman is malnourished, the more malnourished you are, the more likely you are to develop severe malaria for that matter. Because of, again, it affects your immune system for that matter. Patients with, or rather people with chronic conditions, such as diabetes, such as HIV, for instance, such as cancer, they are likely to develop more severe complications. Age, extremes of age. If you are young, very young, or very old, of course, it also affects the severity. So we are a bit more careful when you are dealing with those extremes of age for that matter. And then lastly, of course, pregnant women. I mentioned that. I can't, of course, fail to mention pregnant women because that's what I do. So once you get pregnant, your immune system goes down because of the hormonal changes for that matter. And then you're able now to manage. But there's something Carol mentioned that, if you allow me, just to add. First of all, thanks, Caroline. You're doing a very good job. We have a very, very important function of community health volunteers in this country. And I think, Lenson, you know that very well, that without Carol and such people in the community, we will not be able to advocate, we will not be able to talk about what you're talking about. Because they are penetrating deep into the households. She mentioned some that's very critical. She assists women to even put up mosquito nets. Yeah. So that's something that the radio will not do. That's something that TV will not do. But by virtue of them walking into those households, they are able to do a very important function. And that's what we talk about primary health care in terms of reaching the last mile. We cannot achieve elimination of malaria in 2030 if we don't really embrace primary health care interventions. So how can we support Caroline and such more CHVs to be able to actually have these services integrated in whatever they do on a day-to-day basis? Because there are doctors. I'm here in Nairobi, the gynecologist. My reach is very broad. For her, There are so many in this country. She can actually get into those
and get them to hospital, like you said, time.
And actually address those very specific things that we are talking about. So achieving the last mile. How do you achieve the last mile? Through such interventions as embracing community health volunteers.
And of course, Lanson will also maybe chime to that, and that is the importance of community health volunteers and how then they can be supported. And this is as we fight, to end malaria. But also, Lanson, very quickly, because I can see our time is here, literally like flying. There's that aspect of a new invasive species of mosquito, which again was found in the country. And this is, I think, last month, if I'm not wrong, that was reported. There again, scientists, a bit concerned that it could reverse the efforts made and the gains made against the disease. So, can you tell us a little bit about this species and I don't know, like how different in terms of like the presentation, of the symptoms, if it is different, that is.
Yeah, thank you so much for that, highlighting that. It is in December that we reported this new species of mosquito. It's called Anopheles stephensii. It was reported previously in Ethiopia and South Sudan, Somalia, Nigeria reported, and even Ghana has reported. Those are the main countries that have reported this mosquito in Africa. Why it is a bit unique and why it should bring a lot of concern is because this is a mosquito that has been transmitting malaria in Asian countries for so many years, and through, the world is a global village, and with urbanization and transportation that is happening, some of these species can fight their way in new areas. Why it is special is because this is a mosquito that is breeding in containers, and we know that the mosquitoes that we have been having in Africa and in Kenya particularly, these are mosquitoes that breed in rural areas, in water that accumulate maybe after rainfall, in rice paddies, in streams, rivers, but this is a mosquito that can breed in containers. So in urban setups, you expect people to store water in their containers, and to some extent there is a lot of discarded containers that lie outside the houses, and this mosquito, you are likely to find it breeding there. So all this means we know that malaria has been one of the main diseases in the rural areas, unlike in the urban areas. So this tells you, if we have this species in urban setups, we are likely to have urban transmission of malaria. The other thing is that this mosquito is highly adaptive. It can adapt to different environment, cold environment, high temperatures. When the environmental condition changes, this mosquito can adapt. The other thing is that we found that it is invasive. It is spreading very fast. And unlike the mosquitoes that we have in the country, this is a type of mosquito that can transmit different types of parasites. In Kenya, we know that the parasite that causes malaria is what we call Plasmodium falciparum, and this mosquito can transmit this parasite and another parasite we call Plasmodium vivax. So that's why we are saying this mosquito might reverse the gains that we've had in terms of malaria control for quite a number of years.
All right. So then is it time that we change tact as far as our approach? And this is as far as fighting malaria, very quickly?
Yes, it's high time we change tact. And as I've mentioned, this is a container breeding mosquito. So we might be breeding this mosquito within our houses. So health education is very important, and I would like to urge Kenyans, especially those living in urban areas, let's dispose containers in the most appropriate way, so that we can avoid breeding some of these mosquitoes within the environment. Some of the tools that we have been using, we are looking at how we can change them to ensure that we are not hot and aware so that we can fight this new species.
All right. And then very quickly, okay, I'm told we need to wind up, but very quickly, like a little bit of more time, like 2 minutes more. And this is as far as a very important aspect in this is vaccination. And again, Lensana, I really want you to comment on this very quickly. So the Health Ministry is targeting to vaccinate at least 300,000, children annually, and this is against malaria, and this is a new initiative, and especially in the endemic regions. So I don't know, what would you say to that, in terms of the people who are responding to the same very quickly, and what it would take for the ministry to achieve that very quickly?
Yeah, thank you so much. Malaria vaccine is one of the interventions that we are adding to the regimen that we have in terms of malaria prevention. And we were in the pilot phase, Kenya, Ghana, and Malawi. And we were targeting to vaccinate quite a number of children. So what is happening at the moment, we are bringing partners and government to ensure that we bring this vaccine to the country and have more children vaccinated. We have already achieved over 400,000 children vaccinated in the pilot that we'll be having. But now we are looking at large-scale scale-up where we'll target children within the lake endemic zone to ensure at least we have high coverage.
Okay, all right, and I need to end this. So Caroline, I'm just going to give you 30 seconds in terms of the response that we have currently as far as the fight against malaria is concerned, and what is it that you tell all the women who are watching us this morning, and generally really everybody as far as the fight against malaria is concerned? Very quickly, 30 seconds.
Oh, thank you again. I would just wish to thank the Kisumu County from our Excellency, the Governor, for giving us that opportunity to work in the community and even to give us stipend. And I would also like to thank our partners like IRDO for giving us the RBT kits which we use in the community to test malaria and even treat in the community.
All right.
The Kisumu County Director, Liliana Dayo, Chief Officer, Dr. Lucy, and even our CS, Dr. Ganda. They have given us easy time to work in the community.
All right.
And even to serve our communities as well.
Okay. All right.
And even the Ministry of Health at large.
Okay.
These are the people who have given us time to work in the community in the level 1 as community health doctors. I give them kudos and thank you so much.
All right, and thank you, Caroline, really for really, that eye-opening, really conversation as far as malaria is concerned. And Dr. very quickly in 30 seconds response. And even,
thanks for inviting us for this conversation. It's possible for us to achieve the 2030 targets.
Okay.
But one of the things that, yes, it's very possible. One of the things that we, even as AMREF and other development partners, we are working towards is actually towards primary health care. And we believe that with proper primary health care interventions, and usually we talk about 3 things: integration of services at the most basic level. We're talking about empowerment of the community. We're talking about partnerships. So we believe that with all those activities coupled with innovative interventions, we can actually be able to achieve the malaria targets by 2030. Thank you.
All right. Okay, so then I think let's end the show on that, optimistic and positive note that it is possible for us to achieve the 2030 goal, and that is reducing global malaria case incidence by 90%, as well as reducing the global malaria mortality rate by 90%. So thank you so much. Allow us to end here. Dr. Chris Barasa, Chief of Party, AMREF Health Africa Kenya, Lenson Kariuki, Principal Medical Entomologist, National Malaria Control Program, and of course not forgetting Caroline Ondoro for such insightful conversation. Of course, the conversation continues online. That is at NTV Kenya, both on Facebook and on Twitter, and on our YouTube channel as well, and that is at NTV Kenya. But for now, let's all take responsibility as far as the fight to end malaria by 2030, by doing everything that we can, really. It might be the most basic thing, but let's just try. All right, so have yourselves a lovely day ahead. I'll see you tomorrow morning, same time, same place, right here on Your World. But until then, stay safe. Goodbye.